We are on live now.
Yeah.
Yeah, sure. If it hit like 50, I will just start the intro animation.
Yeah.
Okay,
You,
sure.
you let Jitsi, right?
Okay. Yeah. I share it in Jesse. Can you see my screen? We can just double check
Yes,
it.
man.
Okay, yeah. I will keep sharing there.
And then I'll keep an eye on the comments and
Mm-hmm.
stuff.
Sure. We got like
Oh,
40.
really?
Do you want to start? And I can start the intro animation.
Now give us just one more minute.
Okay, sure. Okay. You can start, Khan.
The aim of this video is to explain how poor oral health is linked to a number of general health conditions, and why mouth care really does matter. Good oral health is important to be able to eat and drink comfortably, to speak and smile with confidence, and to be free of pain and discomfort. The mouth contains millions of bacteria, both good and bad. In the absence of regular mouth care, the number of harmful bacteria multiplies, and this can have an effect on the rest of the body. Oral bacteria are the cause of the two most common dental diseases, dental decay and gum disease. Dental decay, also known as dental caries, is caused by bacteria metabolizing sugar in the mouth and producing acid that causes cavities in the teeth over time. Dental decay is linked to the frequency of sugar consumption. Gum disease, or periodontal disease, generally occurs when ineffective toothbrushing, or an absence of toothbrushing, leads to a build-up of bacteria in the mouth, commonly known as plaque. Plaque is a white sticky substance that develops on teeth and leads to inflammation of the gums, which in turn can affect the underlying bone, leading to tooth mobility, tooth loss, or receding gums. Bacteria, or toxins produced by bacteria, can be absorbed into the bloodstream and travel to other parts of the body. There's strong evidence linking gum disease and heart disease. Oral bacteria can be absorbed into the bloodstream via inflamed gums and travel to other parts of the body. This may contribute to tiny clots or inflammation in the blood vessels that leads to cardiovascular disease. Infective endocarditis may result when bacteria enter the bloodstream of a susceptible individual, for example, somebody with a prosthetic heart valve, and colonizes the lining of the heart, which can lead to inflammation of the lining of the heart valves. The disease carries a high mortality risk, and it's thought it can be caused by oral bacteria. There's evidence that good oral hygiene reduces the risk. There's strong evidence of a two-way relationship between oral health and diabetes. Gum disease can lead to poor blood sugar control, and poorly controlled diabetes can increase the severity of gum disease. People with diabetes are also at higher risk of developing oral thrush and dry mouth. There's an increasing amount of evidence linking poor oral care to community and hospital-acquired pneumonia. The risk of developing pneumonia is higher in patients who are already compromised. For example, those with dysphagia, who are frail, or who have a learning disability. Regular and effective mouth care to remove bacterial plaque and oral secretions is recommended as a measure to reduce the risk and severity of pneumonia. Hospital-acquired pneumonia is a very common hospital-acquired infection with high morbidity and mortality rates, and extends a hospital admission on average by over a week. There's evidence linking poor oral health to a number of other general health conditions, including stroke, dementia, premature birth, and some types of cancer. However, as this evidence is not as strong, further research is needed. Having a comfortable mouth is important for chewing food. Broken teeth, loose teeth, or a very dry mouth are common reasons that prevent people eating. It's important to carry out regular mouth care assessments for people who stop eating and drinking. Care should be taken to prevent denture loss, which can have a direct impact on eating. In summary, supporting people with good mouth care and promoting the importance of good oral health can have a positive impact on their general health and well-being.
Care.
cover a lot of cosmetic parts, but it's the functional part of the teeth that is very relevant. So please do, please start.
Hi, hello everyone. So this is Dr. Sadia. Today I'll be talking about dental care and managing common dental issues. As Dr. Khan said, that we might not be able to cover this broad
Sadia,
topic.
let me just stop you there. See you. I think you need to unmute because they can't hear us. So could you do that because there's a lot of people.
I will just check it.
Yeah.
I'm unmute. Can you check it, please?
You're good. It's not you. I think it's just the studio part. Okay. Can you hear us now? Yeah. All right, Sadia, let's start again one more time. I was saying such an important topic, so much to cover, all very relevant, from inflammation to pain, aesthetic looks of dentists. So walk us through where are you gonna start from, and let's go over some issues because I've already got tons of questions in my mind to ask you. Please.
Hi, hello everyone. So today I'll be sharing the most important topic that is the neglected in our society, which is dental care and managing common dental issues. As Dr. Khan said already, that it's a broad topic and we might not be able to cover it today, but I want you all to get something from it today and have something healthy to your oral hygiene. So we are starting with the introduction, and by introduction, I firstly want you to understand that what our tooth is comprised of. So the most outer part is enamel, the hardest substance of the body, which actually prevents us from the pit and fissure cavity, which is actually known as caries. In our Sada language, it is Kida Lagna. So the next part that you see is dentine, which is not that hard like enamel, but once you lose enamel, you will be prone to getting involved the dentine. And the most innervated part in the tooth is the pulp, which has all the nerve supply. And when you get the most pain in your tooth, it is because that your pulp is exposed and you are prone to RCT or extraction of that tooth. Moving ahead, we have diseases that we need to cover right now. And the first disease that comes here is gum disease. Gum is basically the first foremost thing that is adhering and attaching to your tooth surface, and it is keeping it intact into your jawbone. And once that attachment is lost because of the bacterial inflammation or plaque formation, it is going to compromise the health of your tooth. So as an infection in the gums surrounding the teeth, gum disease is one of the top causes of tooth loss among adults. A lack of brushing and flossing can lead to gum disease.
Very nice.
Coming to the cavities, as I already told you that enamel is the most hardest structure.
So about the gum disease, how would one know that they have a gum problem?
Gum problem arises when, sir, we are taking too much starchy food, carbohydrates, sugary foods, and we are not paying attention to brushing our teeth twice a day and after meals. So that layer forms around the tooth, and what it does, it opens up the attachment of the gum from your tooth.
Very nice.
And the food bacteria will penetrate into the gum line. And then there will be bleeding gums, which will also be the oral cause of your, halitosis, bad breath, and also, loss of the functional tooth as well.
So are you saying if we brush our teeth twice a day, basically you're saying in the morning after breakfast and then at night after we've had food, gum problems will be less. Is that right?
Yes.
They will be less. And then I want to ask you a question to my audience, which is how many of them brush their teeth twice a day? Is there anyone who does it? Because or what would we do if in case we don't brush our teeth twice a day? generally, I think in the dentistry word, people are emphasizing, we're in the habit of brushing our teeth in the morning. But in your world, the evening meal before you get to bed is the one that matters even more. If you had a choice, you have to do both. But let's say there is one. Tell us what should we do in that case where I've got a few people, actually a few of them, they're saying, oh, I'm brushing my teeth twice a day, which is very good. I'm impressed. But let's say for other people who are not brushing their teeth, would you say evening, if we use a mouth refreshener, an antiseptic, does that suffice?
No,
That-
that will not be, because you will only be rinsing your mouth.
Mm-hmm. And wouldn't you be able to get our residual food out? Is that one of the targets as well?
Yes, and for that we need to have the brushing method and flossing as well. We need to put the thread in between the dental spaces to take out the stuck food particles in our mouth and remove the bacterial layer from the meals that we had. So it is most important that we have to do the brushing, and mouthwash is an essential care to it, and dental floss as well.
Okay, so that brings two questions I'm going to be asking on behalf of everyone. I'm impressed. A lot of people actually said twice, and it's great. They are brushing twice, which is good. I asked everyone how many of you floss, and there everyone's quiet. So I'm gonna try to read between the lines. Flossing is not so fashionable. It's like holding a thread and then a little bit left, right, center, doing that, the flossing things. So we're gonna do a little bit of that. So the question is, how long do you brush your teeth? Is there a formula that you suggest? How we could do that?
Yes. For how long? It's for 2 minutes at least. At least for 2 minutes. And for the mouthwash, we need to have it in the mouth 30 seconds to 1 minute.
Brilliant. Okay. I'm gonna let you go proceed forward, and I'm eager to hear what people have to say. Flossing is not very fashionable. I've seen perhaps one or two in your group right now saying they floss, but and I think it's a little bit more time consuming. It's a little cumbersome at times, and you have to have a dedicated session in front of the mirror. Whereas, brush, you could do it on the run, sort of like do other stuff and be able to do it. So please, besides gum disease, let's look at the other stuff as well. I know I've gone into prevention. Please proceed.
Yes, this is the most common thing that we actually see. Yes. So cavities are created by bacteria in your mouth that feast on the sugar and starch left on your teeth after meals.
Mm-hmm.
And after eating these carbohydrates, the bacteria produces an acid waste product that dissolves tooth enamel, that is the most outer part of the tooth, resulting in holes in your teeth called cavities.
Mm-hmm.
So to prevent this, then again, you went into the prevention. If you're doing the brushing, obviously there will be no sugar or starch left on our tooth for bacteria to feast on. So if we are doing a proper brushing, there will be no excess for the cavities in our tooth, and that way we can maintain a dental hygiene and have healthy tooth in our mouth.
Okay. No relationship with chocolate, right?
Yes, no relationship.
See a smile and Dr. Sadia's face as well. No. So women don't have to worry about this because it's got no connection with chocolate.
I mean, if you doubt it, go brush your teeth.
It's like breaking news here. All right, okay. So you're saying both of the first two conditions you mentioned can be prevented by good brushing and a little bit of flossing. Okay, let me ask you another question. This is a problem that has occurred. We've seen the issue of this happening a lot with kids, and it's not easy. It's a nightmare with kids. They're not going to floss, forget it. and even getting their teeth brushed once is an issue. And we know cavities is a problem, a very big problem with them. All the candies they eat and stuff. What do we do in that case?
For kids, like sir, in very early age, we ask the parents of the patient that you need to ask your kid just to brush once before going to bed, because once you are asleep there will be no saliva and there will be no regular cleansing of your tooth. And if there is no regular cleansing of your tooth from the saliva, you will be prone to the cavities and caries more in that time period. So the ideology behind brushing before bed is basically that you remove all the layers from your tooth and you go to sleep, and you are there's no tension about the starch bacteria sticking to your tooth, and you are giving more time for it. Even the kids that are on bottles, milk, feeding on the milk, for that we ask the parents of the children to ask them to rinse with the water at least, if they are very young, so that there is no starch and no sugary item in their mouth for the caries.
Right. So I'm seeing that you put up starch. Uh, by that you mean probably some desserts, um,
Yes.
and you put out some. We're not gonna talk about chocolate. Obviously, chocolate has got nothing to do with it, especially the black chocolate for grown up women, which has got a lot of advantages. But for kids, candies and all relevant stuff, you put a little bit of more emphasis on I imagine. Is that right? And especially for that.
Yes.
Gotcha. Okay, very nice. Please, we'll let you proceed with this, and then I'm keen to hear what the audience is saying. I'll probably interject in between.
Okay, the foremost thing that mostly people who have aesthetically pleasing tooth, but they have this one issue that is like, we have bad breath. We brush our teeth twice a day, but still we have bad breath. So
Really?
for that, I'm going to be explaining it. Many people have persistent bad breath they can't seem to get rid of. The cause, a dental problem like gum disease, cavities, or dry mouth can actually create this bad breath. So the gum disease is basically mostly because there is the detachment of the gum from the tooth, and there are bleeding gums. That is the foremost cause of the bad breath. And then again, I mean, your food is related to everything. If you are having junk food, snacking between your meals, and a lot of sugary items that are going, and there is acid produced in your stomach, that will also cause
Oh yes.
halitosis, that is bad breath.
Oh yes.
So they can't seem to get rid of it even in spite the brushing. So we advance the technique by giving them essential formula for toothpaste and mouthwash as well, so they can get rid of the bad breath for that.
What a brilliant point you brought about. Two things very impressive. One, um, if you've got a bad breath, it's probably some blood in your tooth that smells. It could be sometimes infection, less so inflammation, less so inflammation, food stuck in the tooth, or something else. But also you brought about bad breath can be from what's in your stomach, and you're getting smell from actually residual food in the stomach, which could be like you're burping, you haven't digested your food properly, overeating sometimes, and and as a result, the breath, you're gonna feel it more when it's contained, and then it's gonna manifest in the morning when you wake up. And even though you clean it, it's coming from your stomach deep inside. You can't clean that, so that becomes a little bit of an issue. So really, really, really interesting. Very, very good. Thank you for bringing that up.
Fourth most important topic is oral cancer. I mean, as much as dental hygiene is important, dental screening for oral cancer every 6 months is very important, especially for those who are into tobacco abuse or those who take betel nut chewing, that is also known as chalia in our language, and they keep that for a longer time in their mouth. And those patients are mostly prone to oral squamous cell carcinoma. which is the hard lump that you see mostly as a swelling into the jaws of those patients. So, anybody who is concerned about their dental hygiene should go visit their dentist for dental screening every 6 months. And anybody who is using these substances should also be concerned that they might not get develop oral cancer. And this is really important.
Very nice. I'm asking my team members, how often do we go to the dentist? So I want to hear what do you think? What do you think? How often is that even on the cards? I know in the West we try to make it an effort. It's expensive. I'll tell you, the cost is a big issue for a lot of people, and some are saying yes, they do go once or twice a week. The question is not that you go to a dentist. Do you go to the dentist when you have a problem only, or do you go there as a routine? That's the question that Sadia is bringing up. Sophia, what do you think? But Sadia, isn't it right? If we're not properly cleaning our teeth and we're not doing it twice a week, or we're not flossing it. If we go, let's say we do go there every 6 months, wouldn't they be able to clean it up better, your teeth? If you go in a 6 months to have an extra clean sort of session?
Yes, they mostly people go for scaling and polishing, which is an advancement. If there's any layer from the plaque or calculus that is adhered to your tooth surfaces, they do go for scaling and polishing every 6 months. And I think this protocol should be followed by everyone. But Sophia is right that they only come when they have some issues, like they have toothache, like their tooth is loose and it's moving, and mostly it's because their calculus has deeply adhered to the bone, and now the gum is not there to support the tooth structure, and the tooth is loose and it's moving inside the mouth, and then they'll come, hamara to dant is like hill raha hai ya is tarah ka issue. So nobody's concerned in visiting the dentist, and there are very less people who are concerned about their oral hygiene.
I had a question which is a little relevant, Sadia. I want to ask you. Some people are saying gums shrink, and that can cause a bit of it can cause a bit of looseness in the mouth. Definitely, it disturbs how they feel about the teeth. That's not related to cancer, of course, right?
No, it's not prevalent to cancer. It's basically the gum disease that I have already told you all, that the attachment of the gum is lost from the tooth. And once it's lost and you're letting the food bacteria adhere to your tooth surfaces, the tooth starts, leveling up the surface, and the gums start shrinking. The pattern is going low and low and low, and your tooth structure is moving, which is already I told you, the attachment.
Okay, brilliant. And before you go on to oral cancer, we discussed that. What thing would alert you? I know you said, okay, if they're having tobacco, if they're having stuff that is they're chewing stuff in the mouth, and or keeping stuff in the mouth, that can cause cancer. But what is the sign we should look for and say, oh my God, this could be cancer?
Any ulcer that has developed, or any lesion that has developed into your tongue or your mouth surface that has been there more than a week, you should always consult your dental doctor.
Brilliant. So you're saying if something's persisted, especially an ulcer looking, would you mind describing what an ulcer looks like to the audience? A lot of them may not know what an ulcer specifically looks as such.
For different cases, it may appear different. It might be a red, swollen, patchy, looking like a lesion on your tongue, or it might be on the sides of your cheek and inside the side of your cheeks, or it might be developed on your gums. So you need to always look, and it might, appear scaly, gray, that limited lesion, and it might grow and become hard over the period of time.
Very good, very good. Okay, so it's a scalded skin. It's something that
Yes,
looks that it hasn't got the covering of the mucus or that is normally around it, and it looks a little denuded. It looks
yeah,
a little washed out, raw red area. And then if you're seeing that, because sometimes people have ulcers in their mouth, they're aphthous ulcers that could be there for 2 3 days. Stress ulcers could be there for 2 3 days. Dehydration ulcers that could be there. But you're saying specifically something was very interesting. If it's persisting and it's there over a week to 10 days, be concerned. Is that
yes.
right?
And there might be a lumpy appearance, a hard, bony appearance on your jaw. It might grow like a certain growth outside of the jaw that will be visible. So in that case, you should be concerned as well.
Perfect. Please, please. That is absolutely wonderful, and I think it's really enlightening as well. So thanks for sharing that. I'm going to try to see if I can put in a picture and see if we can do that. But please continue.
So the question that everybody was asking me is receding gums line. When your gums recede from your teeth, the roots of those teeth are exposed, which means anything hot or cold that even slightly touches that exposed area causes extreme pain, and you need to see this dentist for your sensitivity. The reason is that mostly because the tooth structure that you are seeing right now, it has a thin film on it, and this thin film is basically the plaque, and upon the deposition of the plaque, the gums are receding downwards because there is a layer of the plaque. So in this case, the tooth might, lose its vitality as well, and it will move inside the mouth space because it will not be adhered to the bone or gums.
Very nice. Okay.
Mouth sores that we just discussed, that you were telling me about aphthous ulcers. One of the most painful and annoying types of mouth sore is the canker sore. It's often caused by the stress, and it can take up to 12 days to go away. It can also be caused by an injury, like you have had a hard bristled brush and you tried doing it. The friction produced on the gums might develop the sore as well. So for the stress patients, we try to give them multivitamins as well, for the vitamin B12 and anything that can help with their nutrition as well. And obviously we counsel them to, lower their stress, and that way we can, prevent these as well.
Very nice. It's interesting you mentioned stress, and it's also interesting, Doctor, you first time mentioned multivitamins, and I know a specific vitamin that may be related, though it's bleeding gums more. Oranges and vitamin C comes up a lot in that conversation. Relevant?
Yes, relevant. Calcium, vitamin D obviously contribute their part to the healthy tooth structure and bones. So we definitely advise these multivitamins to our patients. But specifically for mouth sores, we might prescribe vitamin B12.
Very nice. Okay, please.
Yellowing of the teeth, which is the most important concern of every patient because they want to have an aesthetic smile. Many people often complain about the yellowish shade of their teeth without realizing that drinks like red wine and coffee, or maybe the energy drinks or other soda drinks that they are having, are major cause of their yellowing of the teeth. So anybody who is having that, they need to refrain from these drinks, and for the vitality and looking sharp and fine teeth, they should avoid these drinks as well.
Okay, very nice.
And for these, we do have bleaching treatments as well, but we do recommend in the case where the patient is not happy about their tooth color. So we provide the bleaching treatments for, whitening of the tooth. Teeth grinding, mostly adults who are experiencing high level of stress, anxiety, they do teeth grinding. Even the childs are prone to do the teeth grinding at night, and for that we advise mouth guards to wear at night, and which help the patient to not clench on their teeth and not grind them unintentionally at night.
Brilliant. We have a terminology that we use in the sleep world. It's called bruxism,
Yes, it's the
and
laws. Exactly.
we use bruxism, and we see also an association with sleep disorder breathing, most commonly obstructive sleep apnea. Their teeth, they grind their teeth, they struggle, and a lot of times people who have nightmares and stuff also do the same. So they have a problem with that, and they do exactly what you're talking about. Very nice, very
All right.
relevant. Before you go on, we discuss your preventive measures, Sadia. CU in the studio has another video that she wants to quickly present. But before we go on to that, I have a couple of questions I want you to ask before we go on to preventive measures. One is that there's someone has said I bleached my teeth, and since then my teeth have been sensitive. So that's a question I want you to answer if you get a chance. The other person, the other question that's come up is that what's the cure for receding gums? And I think sometimes people think that age or weak gums. So that's a question number two. Would you like to look at that? And then the third question is if whitish streaks appear on the oral mucosa, could it be dangerous, especially if they're recurrent? Whitish mucosa, could it be dangerous? Could it be due to GERD? And if it is due to GERD, if it is whitish, because yellowness of the teeth as well as whiteness that comes up, especially when you wake up in the morning. We didn't touch too much on the soda part of things, but I would like you to discuss it in the preventive measures because people think drinking Coca-Cola and all of this is very normal, whereas it has a lot of detrimental effects. So those are the three questions, Sadia, they've come up, and we're going to answer them. But let's see you play that next video. Very, very brilliant. See you. We're ready when you are.
What we do every day affects our oral health more than we may realize. How we take care of our teeth, gums, and entire mouth, as well as what we eat and drink or smoke, impacts our oral health. Oral health is essential for quality of life, enabling us to eat, speak, learn, and interact with one another. Yet, it is something that we might overlook. An estimated 800 million people in the Western Pacific are affected by oral diseases. 1 in 5 adults over age 65 in the region don't have any natural teeth left. And 1 in 2 children under age 9 have dental caries in their primary teeth. Oral diseases and other non-communicable diseases share common risk factors, such as poor nutrition, tobacco use, and harmful consumption of alcohol. More specifically, people with type 2 diabetes are more prone to gum disease, which leads to tooth loss. However, most oral diseases are preventable with good oral hygiene. And it's as simple as brushing your teeth with fluoride toothpaste 2 times a day, eating a healthy diet high in fruits and vegetables, limiting free sugars intake, not using tobacco products, and limiting alcoholic drinks. By practicing oral hygiene throughout your life, everyone can maintain good oral health and live happier, healthier lives.
Very, very nice. Thank you, CEO, for playing that. I think that was very useful I want to have Dr. Sadia pick up the remaining part of conversation from where we left it just prior to presenting this. So, Sadia, would you mind just continuing, giving us a little bit more further update? I want to also add that people have commented about tea and how does that affect, could that be a factor besides sodas, besides coffee, excessive coffee? Obviously, coffee has its benefits as well. Can that be an effect or a detrimental part in dental hygiene care?
Okay, so for the questions that they have asked me, the first one is what's the cure for the receding gums? For the receding gums, obviously we do scaling and deep scaling of the tooth. So as much as the plaque has gone deeper down to the rooter level, we try to clean it and we keep the patient on the follow-up because our gums have the tendency to reattach themselves to the tooth structure, and we keep that patient on the follow up. If that is doing well for them, we let it do it on their own. If not, then we do have surgical procedures for that, in which we place a gingival part and stitch it around the gum level and then let it heal for a certain period of time, and then we remove the stitches later.
Okay, very nice.
And for Sarah Char, it's I over bleached my teeth once and it's been sensitive ever since, dear. You don't need to do it yourself. We have a certain amount of bleach instructions that we need to use in the dental setup. And for that, we need to apply something onto our gums as well. I mean, we need to prevent bleaches. Bleach can make us teeth very much sensitive. For that, we need to do it under guidance and someone who's professional who can use it. So they don't try doing this at home. It's
Uh-huh.
not recommended.
So bleaching can be problematic, but they are now pretty fantastic teeth whiteness. I don't know what it is, but some of them for example, the ones that are out there from different companies are you just apply them for a couple of hours, and their results are pretty good. You
Yes, there are different laser treatments right now that are popular among the clients as well. It really depends on the treatment that you can afford, and it basically starts with bleaching, but it has a very good effect. Your teeth will be sensitive for 24 hours. For that, we provide the sensitivity toothpaste and gums as well, so that they can be less sensitive for that period of time.
Gotcha. Okay. And then the last question on the white streaks appearing and how to look out. How do you know if you have GERD?
This could be sometimes when your teeth are not aligned and you might be clenching onto your inner side of the cheek and sleeping with that position. You need to actually notice your sleep pattern as well, if you're doing that or not, because it does leave whitish streaks in oral mucosa. And by the dentist, if we see it from our level, we can see that as well. And this usually does not happen due to acidity. I don't believe so.
Okay.
And do consult a dentist for Jannat Malik,
Sure.
because
Yeah.
the parents of the structure would actually tell what's causing it.
Gotcha. Okay. Well, let's go on to listen to the preventive measures, and then we'll take it from there.
All right, so let's just discuss the most important thing, that how can we actually prevent all the diseases that we discussed. Brushing, flossing, mouthwash, we did discuss, but I'm going to tell you how we need to do them actually. And eating healthy is the foremost important thing, because once you eat healthy, you're going to maintain it for the life. Brush your teeth twice a day with fluoride toothpaste and floss once a day to remove plaque. And that is mostly the interdental plaque, that is spaces between your two teeth. When brushing, you can try brushing at a 45-degree angle towards your teeth to clean the front, top, back, and gum line. And gum line needs to be addressed, with the medium hard bristles, because it might, injure your gum line as well, and don't need to do that, and that way we might hurt our gums. So this is the diagram, but basically that shows how your tooth should be at the 45-degree. You're doing the front, you're doing the back, and you're doing the top part of your tooth. So all three sides are clean, and they all need to be even on your, the last molar that you see, it should be reached out through your brushing, so we don't leave any bacteria inside the mouth, and that way we will achieve a healthy oral hygiene. For flossing, this is the mechanical way of flossing, and
Mm-hmm.
it's a thread like structure that you can put inside and between your two teeth, and you can push it up and down to remove any bacteria or trapped food inside the gums or between the tooth surfaces.
Is there a specific material, Sadia, you can use for flossing? Is there something you recommend, or is general, just use anything in general that doesn't damage your gums?
It's readily available. It's very light on the gums and it doesn't damage like a thread. Abrasive materials like toothpick, we do not advise them to use it because it's hard and it can also, corrode away the most important structure of the tooth, that is enamel. So dental floss is very light on using, so you can use it, but it's safe for everybody.
And then you mentioned don't use what? To,
Toothpick.
okay.
Toothpicks.
So
Mostly
that's
people
not,
use, yes,
yes,
it
it's
causes
very fashionable.
abrasion of the tooth.
It's very fashionable to use it, especially when you come out from a party.
If you
So,
look at those people, they have, defined spaces between their tooths, if you look at them.
mm-hmm. Gotcha. Okay. Well, that's a good message. Don't use the toothpicks now anymore. It's the fashion is going to go down, and so okay, that's a good point.
Moving ahead, eating a
Please.
healthy diet can help with your dental health. You can also try limiting snacking between meals to help your saliva neutralize acids. So saliva should be there inside the mouth, and it is the most good thing that has happened in the mouth, because it naturally cleanses your teeth when you're trying to speak, when you're awake, and even when you have water. The only thing that we emphasize is that before going to bed, do brush your teeth, because there will be no saliva and there will be no natural cleaning process for the teeth. So it's really important before you go to bed, you brush your teeth, and after your breakfast in the morning, these two times. And additionally, if somebody is very touchy about their appearance and their teeth, they can do one time more in the evening as well. So it really depends on you. And try see the dentist, visit your dentist at least once a year for a checkup and professional cleaning. And that's really, really important for any other concerns like toothache, red swollen gums, bleeding gums, sensitivity to hot or cold, difficulty chewing, persistent bad breath, a loose permanent tooth, or a persistent tooth ache or abscess.
Very nice. I think that sums it up really well. A quick question: what
Yes.
happens if there? Do you? A lot of people have problems when they have their wisdom tooth. Any suggestions for that?
Yes, wisdom tooth is basically erupts in the jaw space, and there has no space in the jaw. And mostly it's partially erupted for everybody. So we recommend mostly people to get it extracted in case it's impacted and it's not coming out, and there is persistent pericoronitis, that is inflammation of the gums, and they have bad breath and persistent toothache. So we recommend to get it extracted if it's impacted, and if it's erupting, we ask them to brush it very cleanly, because it's for the brush it's very hard to reach the backside of the mouth. So cleaning is the trick to keep it intact. And if it's not out of the mouth space, we need to get it extracted. And mostly people get the surgical extractions done in the early years of life to prevent any sort of problems with their wisdom.
Brilliant. One other question. The toothbrush that you've suggested, any specific types, anything that you should not be using? And number two, I have to ask, as being a Khan, what about Naswar? And what about all right, okay, I get the answer about the Naswar, but what about the question on the maswak that people use?
Maswak is
It's a good
organic treatment, obviously organic preventive treatment, and there is no harm using it. And it's the oldest traditional way of cleaning your tooth. And anybody who uses it, they do have pretty good teeth. Only thing is that sometimes it does bring the staining to your tooth, so it's not fashionable anymore. So people do, the brushing is more popular in the population now.
Gotcha. Okay, so that makes sense. That makes absolutely wonderful sense. I don't think I have any more questions for sort of now, and I'm telling all of the audience, if there is any questions, please just put it in the YouTube link, and we'll definitely get back to you. I want to thank Dr. Sadia. What a wonderful presentation. You did really, really great. We're very proud of having you on board with us. It's really nice just to go through some of the common things that we ignore on a daily basis, and it has a big impact. So thank you to you. Thank you to Sophia being around and discussing and sharing sort of like her thoughts on it in between. I want to sum up a last little comment that before we leave, I want to make sure I thank my team. They've always done a brilliant job here. See you, Rida, Hamza, and Hafsa, Malia, and other team members, whoever I have not discussed. So thank you very much. It's because of you guys that this comes around. And I'm just hopeful that the rest of the team are a little bit thankful and grateful for the opportunity you give us. We will have another presentation next week. The topic will come up in a little bit. Anything else you have to share with us?
No, thank you, Dr. I could help anybody who could, get some knowledge about maintaining their oral hygiene, and they could take some good pointers to maintain it throughout their life.
Yeah,
I hope so.
Yeah, absolutely brilliant. I think CEO wants to put up another slide, and it is to congratulate the team from the sleep, and I think specifically Dr. Sophia's effort and the rest of them who have had their presentation accepted in the Boston 2024 meeting in October. So Sophia and I think Brenda were also involved in this presentation. Well done. You brought, this is what I can say. Good job, Sophia. Well done. Keep up the good work. Was that? Yeah, and we pushed you, and I told you because you should have many, many more. I'm hoping that will come this way. This will just open up another door, and then and then the target is to push yourself even more. And I'm pretty confident you're going to do really well. We also wanted to put up our SEB webinar that is on July the 20th. It's a Saturday. It's specifically for an audience back, bringing awareness in sleep medicine. We don't have a slide today, but hopefully we'll have one next for the next presentation. We'll just make sure that that is up. And I just want to say for that, it's for anyone and everyone to participate. I know you may be thinking that is it for just doctors? It's actually just not for doctors. It's an introduction to sleep medicine. So encourage, register, and bring along your friends and tag on. There's a few quick little form that you have to fill so you can get the link, and the rest of you guys, just make sure that you tag other people on. I want to say it's July the 20th, and I think it's at 4 p.m. your time, and our time is early morning. So just a little reminder there to share it in whatever groups you want to share it on Facebook and stuff like that. With that, we'll just sum up. Thank you very much, everyone, for attending. And God bless. Stay safe. Stay hydrated. That's also important, right? This is hot weather. And hopefully we'll catch up next week. Thank you very much. All right, I think so. We're off now. See you. Is that right? Okay. Yeah, that would be good. Just do that. Team, how was it? We were okay. I think it went well. I think the topic was very engaging. I enjoyed it. I don't know if you guys did, but I enjoyed it. Right? Malia, since Rida and Hamza are not here and Zalika and the rest are not going to say anything. Yeah?
Yeah, it was quite well and the topic was interesting.
And I think you can make a lot of good videos from it. You can make one main one, which we're going to now entice and bring in other